Infections with the bacteria that causes walking pneumonia have risen significantly this year, particularly among young children, the Centers for Disease Control and Prevention warned this month. Like and subscribe NewzClub for more updates. The bacteria, called Mycoplasma pneumoniae, spreads through coughs and sneezes and can cause respiratory illnesses. Cases have risen among adults and children, but the most notable increase has been among children between 2 and 4, which experts say is striking given that the bacteria typically infects older children. Data suggests that doctors have diagnosed a growing number of children in this age group with infections after they sought treatment in emergency rooms for pneumonia. Despite its name, only around 10% of people infected with Mycoplasma pneumoniae actually develop pneumonia, which is a type of lung infection. When the bacteria does cause pneumonia, it tends to be milder than other forms of the illness, which is why it's called walking pneumonia. Still, it can cause a fever, chest pain and other symptoms that persist for weeks, and in rare cases can lead to hospitalization. There are roughly 2 million infections with the bacteria each year in the United States, according to CDC estimates. That number is most likely an undercount, though, since many cases are not diagnosed. Cases seem to be dipping after peaking in late August, but the CDC said it isn't yet clear whether that decrease will last, and said that people should stay alert to potential symptoms of an infection. The CDC and other researchers are investigating, but the cause of the increase isn't clear yet. Experts expect some ebb and flow with Mycoplasma pneumoniae infections. Historically, cases have risen around every 3 to 7 years, for reasons doctors are still trying to understand. Researchers also expected case counts to rise after the coronavirus pandemic, when social distancing and other precautions reduced the transmission of Mycoplasma pneumoniae and other pathogens. But Dr. Edens said that over the last 6 months, Mycoplasma pneumoniae infections had been higher than they were before the pandemic. The increase in infections among young children is particularly unusual, experts said. In many cases, the bacteria causes symptoms that feel like a prolonged chest cold, Dr. Singer said. These can include a dry cough, fever, headaches, and fatigue. Children often develop head and ear aches, said Dr. Jeffrey Weinberg, a professor of pediatrics at the University of Rochester School of Medicine Dentistry. Some patients also develop a rash. In rare cases, infections can trigger asthma attacks or lead to kidney dysfunction and brain swelling. Infections can also become severe in people with compromised immune systems. The CDC is closely monitoring for resistance to those antibiotics in the United States. Experts have documented such resistance more frequently in Asia, but it is not common in the United States. There's no vaccine against the bacteria, which mainly circulates among people who live together or spend time in close contact, such as classmates. Most people who briefly encounter someone with the bacteria will not get sick. Covering your face when you cough or sneeze and frequently washing your hands can help curb the spread. Doctors said.